Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Pneumomediastinum and the hydropneumothorax. So to begin with, the pneumomediastinum, it is the most sensitive investigation being the CT scan. This is a very good investigation and sensitive investigation. The causes, there is a Borhave syndrome. So Borhave syndrome will be the cause of the pneumomediastinum, and looking upon the CT, it shows the air surrounding the arch of aorta. So there is air, and this air will surround the arch of the aorta. Next is there is also the CT chest which is seen. The CT chest is seen with the contrast. So CT chest with contrast is nothing but the investigation of choice. Then we're moving on to the hydropneumothorax. The hydropneumothorax, there is presence of air fluid level. So this air fluid level here, characteristically, it is only horizontal. It is always horizontal. To learn and grow daily like this, please do subscribe.